Good day, this is Professor Will, CBMD PhD, and today's Saturday, October 9th, 2021. It is 7:27 and 16 seconds, p.m. Eastern Standard Time. And today's diary, an important summary of my last meeting with Dr. K. So let's hop to it here. Dr. K often makes comments that I had to constantly correct and clarify throughout the entire conversation. He just guesses, doesn't listen, and doesn't even know me. Please, watch videography number 11 to help clarify most of your misunderstandings about my past. You are clueless and have no right making assumptions or playing the guessing game, pulling a rank on me, and embarrassing me with such misinformation. The amount of psychological trauma that I experienced in my life is beyond repair, and you do not have any scientific instrument to prove otherwise, and I still live life to my fullest potential. And if you think the reason I went through psychotic episodes in my past is due to schizophrenia, you are wrong. Please, let's set the record straight. You are all too quick to make false allegations, take things out of context, and make assumptions. Think before you write, speak, or even attempt to judge someone. Mental health professionals come off as blunt stereotypes. Take note that I felt I was verbally attacked by my mom's boyfriend on several occasions. He went through several psychotic episodes, and I handled myself well throughout the attack. I utilized my assertiveness skills and didn't engage with his verbal and violent behaviors. I should get a gold star for my assertiveness skills. Dr. K continued to play these guessing games during our last meeting, made assumptions, and didn't listen to anything I wanted to say. Overall, I think he needs to really pay attention to what others need to say, instead of reading all the nonsense written about people in the history of hospital reports. Most of these healthcare professionals and doctors are uneducated. Pull up some PDFs on Project Blue Book, Project Yellow Book, Project Aquarius, Operation Paperclip for starters. Then look into Project Looking Glass, the Illuminati, and sum that up with biological warfare. Now, is that enough specifics? Look up the history of espionage and slave races, and just then maybe the healthcare professionals will get a different perspective. I read all of those top secret classified books 20 years ago, and most of that stuff was known as conspiracy theory at the time, but now it is known as conspiracy fact. Most of the stuff written inside the clinical reports are all hatched, and written by nurses that come to work impaired. They smoke cigarettes on the side of the highway and have shrunken and constricted blood vessels to the brain. Most of the staff are intoxicated with carbon monoxide poisoning caused by cigarette smoking. The so-called professionals that know what is best for your health. Nurses suffer from cognitive dissonance caused by the lack of oxygen to the brain and are maladjusted from their weekend intoxication and can't make any sense out of anything, most often taking things out of context and putting patients in a bad light out of anger or envy, and taking their problems to work. The so-called professionals who gamble people's lives in the name of helping them. Most nurses or caregivers are clueless. They are just as bright as an Xbox or 2-page comic book. Please, listen to your patients when they are talking. Some of them might be telling the truth. Put your pride aside and put your doctorate degree back in the cereal box where it belongs. And pay attention. Be aware of your surroundings, and stop playing God. I don't blame Dr. K, as he is just trying his best to work with what he has. But please be aware. Ask more questions. Utilize them without judgment, and acknowledge empathy appropriately. You need to remember, I've been in this particular field and scientific arena longer than Dr. K, and most of these doctors that work in the field. Pay attention, and don't be too quick to judge or write about people you don't know. Everyone has their story, and unless you walked 1,000,000 miles in someone's shoes, think again. And this videography was written by me, Professor Will, CBMD PhD, scientist, researcher, philanthropist, and writer. My videographies mean a lot to me. I hope you enjoyed listening. This videography was written for educational purposes only. Until next time, have an excellent day.